Hello, and welcome to a presentation on the North Carolina Health Equity Impact Assessment for Public Policy Advocacy. My name is Vikki Crouse. I'm the Health Program Associate at NC Child. We're a nonprofit focused on building a strong North Carolina by advancing public policies to ensure that all children, regardless of race, ethnicity, or place of birth, have the opportunity to achieve their full potential. So let's get started. #impactEQUITYNC is a statewide initiative to develop, test, and disseminate a tool to evaluate the impact of public policies, programs, and administrative practices on state and local health disparities in North Carolina. Impact Equity is a collaboration between NC Child, the North Carolina Division of Public Health, Women and Children's Health Branch, the North Carolina Office of Minority Health and Health Disparities, and the Rockingham County Department of Public Health. The intended result of this initiative is that every North Carolinian has the resources and opportunities to attain his or her best health. So here's a quick overview of what I'd like to cover today. First, I want to answer the question, why we focus on health equity. Then, I want to talk about what exactly the Health Equity Impact Assessment is, and why is it important to do HEIA in public policy. And finally, I'm going to walk through the HEIA with a policy example. We get the question pretty often, why focus on health equity? Well, we do that because health is essential to everything we do. In order for children to learn, parents to work, and communities to thrive, they all need to be healthy. And that concept is so simple that it speaks across political ideologies, cultural contexts, and the geographically differing perspectives of various parts of the state. The environment in which one develops before and soon after birth provides powerful experiences that chemically modify certain genes in ways that then define how much and when they are expressed. Therefore, while genetic factors exert potent influences on human development, environmental factors have the ability to alter family inheritance. So here's what we know about health when it comes to children. Development is highly interactive. Life outcomes are not determined solely by genes. The stress of exposure to adverse childhood experiences can derail children's healthy growth and brain development. Throughout early childhood, children need early, consistent, high-quality supports to promote and sustain their developmental gains. So as policy advocates, we want to ensure that health equity as a goal is about more than ensuring an absence of health disparities. It's about ensuring equitable access to the fundamental resources that promote good health. So often we may hear, a rising tide lifts all boats, but we know that it doesn't close gaps or eliminate disparities. Take, for example, infant mortality. In North Carolina, we've made significant reduction in overall infant mortality rates over the last 2 decades, although our progress has plateaued in the past 5 years. But our racial disparity in infant deaths is roughly the same today as it was in the late decades. Black babies still die at a higher rate each year than white babies or Latinx babies. So we may think that a rising tide lifts all boats, but in fact, it does not close disparities and gaps. With that in mind, here's our approach. North Carolina is at its best when every individual, no matter their race, ethnicity, income, gender, or location, has the opportunity to reach his or her best health. Ensuring health equity for all requires changing policies, systems, and practices to address health inequities and reduce long-standing disparities that have existed for years. The HEIA tool provides a structured process to guide the development, implementation, and evaluation of policies and programs in order to promote health equity and ultimately reduce disparities. The tool itself consists of a series of worksheets, each building on the previous ones. The worksheets are intended to focus discussions and document proposals. There are several applications for the HEIA, policy being one of them. The HEIA can also be used to evaluate existing state or local programs or to develop new ones that ensure equitable outcomes. They can also be used by community-based organizations to assess agency policies. So for our purposes, as state and local policy leaders or advocates, we can use the HEIA to examine implications of legislative proposals or to proactively design more equitable policies. In order to ensure that our public policies are equitable, we need to, 1, identify existing gaps so policies can address them, promote community-informed policymaking, meaning we take into account the needs of impacted communities from the community voices. We measure impact. We don't know what we don't measure. So the HEIA is a 4-step process. But before you begin with these steps, a small leadership team should work through the 3 pre-work steps that will help you identify your policy, your self-assessment, and your data. The 4 steps of the HEIA will be completed jointly by your leadership team and the implementation team on the day of the assessment. It's strongly encouraged to implement steps 1 through 4 of the HEIA at the same time with your same group of people. So the 4-step process is as follows. 1, you're going to ensure that all team members understand the policy that will be assessed using the HEIA tool. In your second step, your team will develop a specific problem statement for the policy using your data profile as well as a root cause analysis of the problem to understand the root cause or causes of the issue. In step 3, with a problem statement in hand, your team will determine what modifications need to be made to the policy to reduce the root causes that contribute to those health inequities. Finally, in step 4, your team will develop an accountability plan to continue to monitor the impact of the policy, the modifications, and to ensure that disparate impacts and negative unintended consequences are assessed and remedied. Now, like I said, before we jump into those 4 steps, here's a quick overview of the pre-work steps that the HEIA guides you through. I quickly mentioned these in the last slide, but I'm going to let you all check out your HEIA document to delve into those further. All right, so let's assume you finish your pre-work. Our example today is a paid family leave policy that we're crafting together. So in your first step, you're going to describe your policy. In our case, we're describing the absence of a paid family leave policy. Here's our description. The vast majority of working people in the United States do not have paid family leave through their jobs. In North Carolina, even unpaid leave under the Federal Family and Medical Leave Act is inaccessible for 64% of working people. This means North Carolinians face impossible choices when new children are born or adopted, and when serious personal or family health needs inevitably arise. A paid family leave policy for all workers is needed in North Carolina. In your second step, your team will develop a specific problem statement for the policy using your data profile, as well as a root cause analysis of the problem using a but-why technique. So this step assumes you've completed your data profile, but let's take a look at some examples of what data you'd be presenting at this step. So firstly, your HEIA guide provides you with examples of how to identify the data you need. The Key Factors Checklist is one such tool that helps you identify individual demographic factors as well as community structural factors to inform your analysis. You'll note that not all of this data is quantitative. Some of it can be qualitative, meaning you can collect that data through focus groups, interviews, those sorts of methods. One way to organize your data collection process is to use this table template. Here's an example of what kind of data we'd want to identify for a paid family leave policy. Like I said previously, some of this data can be qualitative, which means that it captures characteristics that can be observed but not measured. So in this example, let's say we're looking at what data we need to learn more about paid family leave. Well, individual factors of working North Carolina residents who don't have paid family leave could include race, ethnicity, gender, health status. And that would help us because it would help us identify populations that are disproportionately affected by the absence of paid family leave policy. Who are the groups of people that are most likely or more often excluded by, a lack of paid family leave or even unpaid family leave? So I'll give you a minute to read over some of the other examples on the screen. All right, now that you've assessed your data profile, you're ready to make your problem statement. So for this example, our problem statement is, Providing at least 12 weeks of paid family leave can improve child health and family economic well-being and reduce gender inequity in the workplace. There are disparities in access to paid leave across the state as fewer African American and Latinx workers, and particularly women, have access to paid family leave through their employers. Now we can work on identifying the root cause or causes of this problem. Why exactly do we see disparities in access to paid family leave? We apply a but-why technique to get to the roots. The link to the instructions for this technique can be found in your HEIA tool. I'm going to try to pull up here to show you what you can expect. So here you can see this tool, this technique is part of the community toolbox, which is just a great overall resource for addressing community-wide problems. So it gives you a broad overview of what root causes are, what the but-why technique is all about, why you should use it, when you should apply it. And then it gives you a very solid example walkthrough of how to use it. So here's an example. So I won't spend too much time on this, but I just wanted to show you what you can expect. And I encourage you to delve into that when you open up your HEIA document. All right, so in step 3, with the new problem statement in hand, we're going to determine what modifications need to be made to the original proposal to reduce the root causes that contribute to health inequities. So we're going to identify 3 assets or strengths available among our priority population that can be leveraged, identify 3 challenges impacting our priority population, make a list of potential modifications, and then forecast potential positive and negative impacts. So when we think about this last step of identifying potential negative and positive impacts, we have another tool in the HEIA that can help guide your thinking as you consider these. So if we're thinking about modifying our paid family leave policy, say we want to increase the mandate from 9 weeks to 12 weeks of paid leave. How will this modification impact workers? How will it impact employers, etc.? We start to outline those in this step. Here is an impact category table that's available in your HEIA that can help you to think through what some of those impacts might be. You can also use a template table to organize your thoughts in this step. So here's an example of that. Our goal here is to not worsen. Obviously, we don't want to worsen existing health disparities. We want to reduce them. We also want to pay attention to what other unintended consequences our policy could have. And it's likely that your team will generate a long and varied list of potential modifications. That's fine. So in the HEIA document, we also include other tools you can use to analyze these. If your list gets really long, how can we narrow those down? So you can use something like a SWOT analysis, but we have other examples in the guide. In step 4, the monitoring process will determine if the intended outcomes of the policy occur and how disparate impacts or unintended consequences were addressed. We identified potential impacts in our previous step, and we want to monitor those if we decide to go through with them. So this step helps your team create an action plan so that they don't just fall through the cracks. This process also includes the development of a communications plan that will ensure that feedback to the impacted community partners and other stakeholders occurs. So you would need to determine how information on the policy proposal, the modifications, and the outcomes of that policy are communicated back to them. And being that this is the last step in the process, it's very important to set a timeline for future meetings with your team to check in on your proposal and monitoring plan. Evaluation is often data that we forget to collect, but it's very important for letting us know if we've achieved the outcomes that we're aiming for. So here's an example of a tool you can use to help your team identify who will lead the modification action plan completed in the previous step. And we have other tables that will help you guide your thinking and your process at this stage. You can find those in the HEIA guide. All right, so now that I've broken down the process a little bit, I'm going to let you all get started on the HEIA. You can find the HEIA tool on NC Child's website. Links are here on the screen. But if you want to navigate our website, you can find this tool under our Health and Wellness tab found in the What Children Need section. We have our download page set up so that we can collect a little information about how you plan to use the HEIA because we're so curious. And if you're interested, you can also share with us your contact information so that we can provide any technical assistance and get feedback from you on the tool. And if you have any questions, please feel free to reach out to our stellar Impact Equity NC co-coordinator, Sarah McCracken at the Division of Public Health, Women and Children section, and Whitney Tucker, who's a research director here at NC Child. Here's our contact information. Well, thank you all so much for letting me part of your day to learn about the Health Equity Impact Assessment, and I wish you all the best of luck.